Hello lovely viewers, welcome back to my channel. This is your midwife Bella. If you are new on this channel, kindly subscribe, like and share this video. We are treating vaginal candidiasis today. Most women experience a yeast infection sometime during their lifetime. A vaginal yeast infection, that is vaginal candidiasis, is caused by an overgrowth of a fungus that naturally lives in your vagina, called Candida albicans. The overgrowth triggers irritation, inflammation, itching, and painful discharge. Stay tuned for more. Hello guys, welcome back, and we are still on the topic vaginal candidiasis. Candidiasis is an infection caused by a yeast. That's a type of fungus called Candida. Candida normally lives inside the body in places such as the mouth, throat, gut, and vagina, and on the skin without causing any problems. Sometimes Candida can multiply and cause an infection if the environment inside the vagina changes in a way that encourages its growth. Candidiasis in the vagina is commonly called vaginal yeast infection. Other names for this infection are vaginal candidiasis, vulvovaginal candidiasis, or candidal vaginitis. Now we come to the symptoms of vaginal candidiasis, and it includes vaginal itching or soreness, pain during sexual intercourse, pain or discomfort when urinating, abnormal vaginal discharge, and although most vaginal candidiasis is mild, some women can develop severe infections, including redness, swelling, and cracks in the wall of the vagina. Now, contact your healthcare provider if you have any of these symptoms. These symptoms are similar to those of other types of vaginal infections, which are treated with different types of medicines. A healthcare provider can tell you if you have vaginal candidiasis and how to treat it. Now we move to risks and prevention. Who gets vaginal candidiasis? Vaginal candidiasis is common, though more research is needed to understand how many women are affected. Women who are more likely to get vaginal candidiasis include those who are pregnant, a use of hormonal contraceptives, examples, birth control pills. 2, those who have diabetes and those who have weakened immune system, for example, due to HIV infection or medicines that weaken the immune system, such as steroids and chemotherapy. The next one, those who have recently taken antibiotics or those who are taking antibiotics. Now, how can I prevent vaginal candidiasis? 1. Wearing cotton underwear might help reduce the chances of getting a yeast infection. 2. Because taking antibiotics can lead to vaginal candidiasis, take these medicines only when prescribed and exactly as your healthcare provider tells you. Learn more about when antibiotics work and when they when they should be avoided. The next prevention is visit your gynecologist every 6 months for early detection and treatment of any condition that affects the reproductive system. Visit your healthcare provider if you have signs of vaginal infection, as mentioned earlier, to prevent the spread of infection through the reproductive organs. Wash underwears regularly and dry them in the sun, and possibly iron them when dry. Maintain personal hygiene by bathing twice daily with clean water. Wear breathable underwear. Cotton is the best choice. It doesn't hold on to heat or moisture. It will help keep you dry. Keep things loose. Make sure your jeans, skirt, and underwear are not too tight, and which can boost your body temperature and increase the amount of moisture around your private parts. That raises your chances for a yeast infection. Don't douche. Feminine hygiene products like douches that are inserted into the vagina can disrupt the balance of bacteria in your vagina by removing some of the good bacteria that is supposed to be there to fight against infection. Just rinse with clean water without inserting your hands into the vagina. Don't sit in a wet bathing suit after you go swimming or damp workout outfit after the gym. Change into dry clothes right away. After visiting the toilet, always wipe from front to back so you don't introduce infection from the anus into the vagina. When on your periods, change your tampons, pads, and panty liners frequently. Manage your diabetes if you have it. Be sure to keep an eye on your blood sugar levels and keep them under control. Sources. Now, scientists estimate that about 20% of women normally have candida in their vagina without having any symptoms. Sometimes, candida can multiply and cause an infection if the environment inside the vagina changes in a way that encourages its growth. This can happen because of hormonal medicines or changes in the immune system. Diagnosis or testing. Healthcare providers usually diagnose vaginal candidiasis by taking a small sample of vaginal discharge to be examined under a microscope in the medical office or sent to the laboratory for a fungal culture. However, a positive fungi culture does not always mean that candida is causing symptoms, because some women can have candida in the vagina without having any symptoms. Now we come to treatment. Vaginal candidiasis is usually treated with antifungal medication. For most infections, the treatment is an antifungal medicine applied inside the vagina or a single dose of fluconazole taken by mouth. Other treatments may be needed for infections that are more severe, that don't get better, or that keep coming back after getting better. These treatments include more doses of fluconazole taken by mouth or other medicines applied inside the vagina, such as boric acid, nystatin, or flucytosine. Thank you guys for listening. See you in the next video. Bye.